Bye.
So we're going to switch gears now. We're going to move into our breakout discussions. We're going to encourage you to we're going to take about 20 minutes or so to have you reflect on what we've considered this morning already. We've had certainly great discussion with April Lewis on work well, on how to manage your time and your energy. And we've heard from Gary about culture transformation within the organization. As you move into your breakout groups, and we'll have you placed in those momentarily, we want you we'll follow our approach that we had yesterday to introduce yourself to your peers, first name, last name, title, and organization. And then we'll ask you to name a recorder. We'll post a Mentimeter in the chat that you can use for those recorders to plug in the one or two key points from the discussion. We asked the recorder to record one or two key points from the discussion that you'll place in the Mentimeter for all of us to be able to see. The questions that you'll consider in the breakout group are, sort of what's top of mind after the discussions that we've heard here today. What is the top of your mind? Number two, what are you already doing and what might be working or not working? What are you already doing? What might be working and not working? And then lastly, what are you planning for the future? What might you incorporate based on the discussions that we've had today? So top of mind, already doing, and for the future. Those three key points in your discussions. So we're gonna move you into your breakout groups here momentarily. It looks like they're already up. You should have a member of the planning team or the advisory group that's in your breakout groups to help you if you run into roadblocks. So have a great discussion. We'll see you you can take a break at, looks like 10 minutes after 3 Eastern time, 10 minutes after 12 Pacific time. Enjoy. Hello, everyone. Welcome back. Looks like our panelists are here. We had an opportunity to hear from Gary Campbell about the coaching culture that they've established there at Johnson Health Center. Now we get to hear from some experts working in the field. So moderating this panel discussion is Stephanie Roden, who we got to hear from yesterday, who's the Chief Operations Officer at Roanoke Chowan Community Health Center. So without further ado, I'm going to turn things over to Stephanie.
Good afternoon, everyone. So excited about our coaching culture session this afternoon. It is with delight that I introduce to you Dr. Mary Blankson and also Jan King Robinson. Today, we would like to pick their brains about their coaching culture and motivation to coach at our health centers. And without further ado, I have a question. So each of you, would you tell us what motivated you to want to support a coaching culture within the health center sector? And welcome.
Then why don't you start and then I can go next.
Let's dig in.
That's great. That's great. My motivation to work with FQHC comes from having worked in hospitals for many, many years, having worked in educational environments for many, many years, and knowing that that was the population of people that we were serving both in the hospitals and in education realm, poor, rural, disenfranchised areas, which is where my heart laid. And so that was the motivation. So while I was at the hospital, I did have an opportunity to have a responsibility for our community health clinic. And then I learned about our federally qualified health centers and just retired, and colleague started calling me and say, hey, you've been around for a few years, you got some advice and counsel. So I had been consulting with other hospitals and thought, this is really where my heart lies. So that's why I'm here.
Thank you for that, Jan.
Thank you.
Awesome. And for me, so in my background, I'm a family nurse practitioner. And from the moment I graduated as a family nurse practitioner, I took my first job at a federally qualified health center, the very same one that I still work at today, 17 years later. But I started out as a primary care provider and working with my own team and really trying to figure out how do I take good care of this amazingly diverse, complex, wonderful group of patients, of all age groups, because I'm a family practitioner. And then as I sort of grew within the context of my position at the health center, got involved in committees, got a lot of wonderful coaching and mentoring myself, wound up taking on smaller, sort of less formal leadership positions, and then ultimately ended up in this role of the chief nursing officer 8 years ago, where I guide and lead close to about 180 staff across our network. And a lot of my staff, particularly my medical assistant staff, this is their first position as an entry into the healthcare workforce. So to have an opportunity to have support, to train, and to grow is so very important. But from the moment I set foot in an FQHC, I knew I was never going to leave. So here's to 17 more years.
All right, I second that. So we know the complexities of health centers is vast, and we understand that leadership across health centers are it's so important for our mission and for our movement. Can you tell us, with your vast backgrounds in leadership, how have you supported a coaching culture within health centers?
Sure, I can start with this. I think, for myself, it's been a really, really long journey, because I think in order to really have effective coaching, there's a lot of different elements and pieces to the puzzle that you need to have all along the way. And it started very small and very simply in my first year as a chief nursing officer, really trying to figure out how do I create the documentation, the training and support that we need to really define all of our support staff roles and other roles along the way. As one of the, I think, core components of having a really good coaching culture is making sure that roles and expectations and sort of standards are really spelled out, so that everybody kind of knows this is what's expected of me, this is what's expected of my team member, and this is how we support each other. This is where my role begins, this is where it ends, and where I need to really leverage your specific gifts and talents for success. And really it's sort of through that knowledge and through that education that we can then sort of identify folks with specific talents, champions along the way, to really engage them similarly as to how I was engaged growing up here at the health center as an informal leader, being able to develop my skills and hone my skills before I took on anything formal. But really, I think it's through those relationships and through that support that we have this transparent culture where we can talk about measurement and we can give feedback, because it's all for the purpose of us taking good care of patients, taking good care of each other, and really being successful at the end of the day. So a lot of it has to do with your communication style and your verbal culture. What are the words, or how do you describe things? One of the best examples that I always share is particularly with medical assistants, because this is a group I've been working a lot with at my health center and at other health centers across the country, is how do we make sure that medical assistants know that when we are delegating work to them, it's not because we just are trying to make the lives of the providers so much easier and we're just seeing them as a downstream catch-all, but really because we're valuing their unique talents, their unique training, their ability to be masters of the health record in terms of knowing what to click and when to click it and what it means when you click it. Whereas sometimes as providers, we're much better at free texting and sort of telling the story and giving that full background. So it's really out of this culture of value instead of a culture of we're just trying to make one staff member's life easier or better, or to retain one type of staff member. So yeah, I think that's sort of the general that I'd like to share at this point. Go ahead, Jen.
Okay. I have a real mixed background in terms of academic and hands-on. And so I'm going to be academic for a second because this is the place I start. When I think about coaching culture, for me, that when I heard that phrase, I put it in the context of human resources, organizational development, talent management, and leadership development. And through my 40 plus years of work, I have been very, very fortunate to have people coach me even before I got into the work world. You know, my father, my mother, my brothers. And one of the things my father would often say is, you must be coachable. And I grew up hearing that. What does coachable mean? He said, and my mother's response to that was, don't wear your feelings on your sleeve. You know, you've got to be able to get feedback and take what you can use and leave what you can't use. Even if what you're leaving may be most valuable to you, you'll figure that out at some point if you're coachable. And so those kinds of enduring lessons stuck with me. And along my career, always in operations and management, I went to law school, got out and decided I would work in employment law, and only spent a year there because I felt like, I want to be on the other side of this. Because I see the folks that are coming in with the issues, they're too late. Where do you really start having the conversation about culture throughout? So when you're asking, and you know in your company how many light bulbs are changed within a year, because that's important to know what everybody at every level is doing, and that we can acknowledge all the way up to, you know, that kid that's changing those light bulbs. He's really a go-getter. What are we going to do to cultivate him and engage him? Because I've always lived in small communities. There's not a lot of choices and places where you can go. How do we identify this kind of talent? And who else is looking? Because all these nice comments are being made about folks. Well, how do we redirect that into skills and strategies that we're really going to adopt here that we can share throughout? So it's just not one or two people looking for talent, and how to keep talent. Because we know in small rural areas, keeping talent is a major challenge. And as long as folks are excited and growing, it's not always just compensation. It's the level of engagement. Are they working with other people who are inspired and doing great work? Long way around. I hope that answered your question.
Absolutely,
I
Jan.
will say, Jan, it's not just rural areas that are struggling with staffing.
I
It
know
is
that's true.
literally everywhere,
Well, especially
everywhere.
with nurses. You're right. You're right.
And so with that struggle everywhere, how do you then reach the individual who is of great value, but not so coachable?
That's a good question.
I mean, I think there's a lot of strategies to do this, and I think you know, of course, one of the most challenging strategies, though, which I think is actually one of the most successful, and is really just making sure that you have a very open door policy. We have listening sessions at our organization where we are always kind of meeting. We have these be paid sessions. They're after hours, so that way nobody's distracted with clinical work or with other things, but where we really try to listen and see what are the challenges that people are facing, what are the things that they feel like they need more of, less of, what isn't, you know, working well, what's going bump in the night. And with that, you know, oftentimes, just as Jan was discussing, sort of leaders may emerge, or people that might end up being spokespersons, you know, for the group of staff that you're supporting. And really, you'll get to understand that kind of every section of your workforce really needs different things. You know, back at CHC, one of the things that we have worked on over the course of the last probably 9 months of my life has been, we had new legislation that finally passed to allow medical assistants here in Connecticut to give vaccines. But as you can imagine, since this has never been allowed, we have had to go through this huge transformation of our workforce to get a bunch of medical assistants who aren't certified, and then have them do additional training and support, you know, all throughout the way, just to take on this new clinical opportunity to be a vaccinator, which at first, you know, was very, very challenging. People were like, well, I don't want to do any more work. You know, why do I want to do more work? How are you going to compensate me more? What are you going to do? And really, as we listened more and had more individual conversations, what we found is that, you know, people were really scared about becoming certified. They were nervous about taking the exam. They were worried about what it would mean for their job if they failed. They were worried about actually having to vaccinate somebody or vaccinate a child. You know, maybe they felt okay vaccinating an adult, but it was really scary to think about vaccinating a child. But as we listened more, we really found that we could split our workforce up into about 6 or 7 different groups where the needs were very different. And I could meet with them sort of one-on-one to, you know, hold their hand when they needed hand holding, give them support, like paying for the exam and reassuring them that if they had to take the exam a second time, that we would still pay for the second time. you know, and that their job wouldn't be in jeopardy, and just giving them that level of reassurance. Not only did I think it, you know, it go a long way to let them know that, you know, you can have an audience with a clinical chief. You know, I'm not so far up in the stratosphere, but our organization really is flat enough that we can have a conversation, a meaningful one, that I recognize you and your function and your role, and that I can show you a future that I see for you that you may not see for yourself.
Wow.
And kind of, you know, being able to support them to dream big dreams is, you know, exactly what we hope for, even when it's scary.
Yeah, I think one of the things too, Mary and Stephanie, is that we have to train our supervisors or managers in the language of coaching, in the language of talent, of identifying talent, and there being opportunity to say, boy, we really have a hard charger here. This person, where do you see the customer service that they have provided this patient, or how they were just right on the money with this physician? And is there a formal way of recognizing that talent? Is there within the organization a high potential program at all levels as a way of, particularly I speak from small communities, but as you said, it's happening all over. There are lots of choices, and it's not just money that we said before is keeping folks. You know, it is, do I have people that care about me or looking at me, giving me opportunity? And how do you build that? So unless at the highest levels you're not valuing that, then you don't have it as a construct. You don't have it as something that's being discussed across the executive tables or management tables. So I think it has, for me, the most valuable way of working with folks who have the potential to be coached, may not recognize it or want to be coached, is already having a system in place to be able to develop those skills. And some of your senior, not even your seniors, but your leaders, and those leaders can be at any level, that already show some aspect of those skills. And then engaging them and teaching them, you know, what is this thing called coaching? You know, it's not what I think you should do. What is it that you have an interest in doing? And what is my assessment tool to see? Does that match what my needs are here? Or do I have a roadmap that I can invite you to look at it, and we work out together as a way of helping to develop your skills and put you someplace where you have some excitement about? Does that get close to what you were asking, Stephanie?
Absolutely. Mary and Jan, I've had the benefit of being coached, but I have to be very transparent in saying that it was very difficult for me to receive the invitation as I grew in leadership to be coached. What advice would you give to our organizations who need to consider coaching as a method of growing, on how to help their peers and leaders that they have identified as great leaders with full potential in receiving the invitation of coaching?
I'm going to jump in on that one because I've had that responsibility of creating those programs for different organizations in different sizes, a system as well as an independently owned hospital. You got to have a program so that when we talk about coaching, it's not looked upon as, gee, you know, this is a performance improvement plan. No, this is how to develop you because we want to keep and retain you. And so that coaching does not become something that you feel like, oh, gee, why was I picked out? That it's something that is known throughout the organization that this is a great opportunity. And even if there's a formal program, you may find somebody within the organization that you are responsive to, that you feel is really giving you some feedback that you haven't gotten otherwise, or you could hear from where you couldn't hear from somebody else because of whatever the dynamics are. So that there's opportunity for coaching to be a culture and not just come through a specified program. So I think that it's new enough that some of us have been coached and think, well, gee, why am I being brought in here? What am I not doing? As opposed to, gee, they've picked me out because they see potential here and they want to fan this potential, and they're going to give me some skill sets and introduce me some things that I haven't otherwise been exposed to.
I actually had the great privilege during my doctoral program, and then actually brought an expert into our community health center specifically for my nurse managers, where we did some programming around personality testing, and there's also a leadership inventory that we did. And it actually was a really, really wonderful opportunity for us to talk about sort of strengths and opportunities, which I think oftentimes when you use those types of tools and then have structured, facilitated conversation around it, it really does, kind of bring you to this opportunity where you can talk about how every single person needs coaching, right? We all have strengths, we all have weaknesses. I think this is where one of my strengths as a leader in terms of being able to be vulnerable with my staff is really beneficial, because I try very hard in my verbal culture with my department in particular, but also with other providers and other staff, to talk about the ways in which I've received coaching as an executive leader, to really try to show them that we believe in coaching at the very highest level and every other aspect. There have been times when I've said, I can feel very passionate about something, which, when I'm speaking at a conference is a huge value, right? Other people hear the words that I'm saying, they feel really drawn to the messages. But if I'm in a meeting, where I feel very passionately about something, it might sound like I'm upset or angry with another department or with another person. And that can be, really deeply personal, for the other person receiving that passionate message. And so, being able to give these examples that we are not perfect people, but we are people who are committed to working to always perfect what we're doing, and to always think of feedback as a gift, I think really gives permission to everybody to see, I wonder what I should be working on, or what my growth opportunity is, because they see that growth in their leaders as something that has made them to stand apart, has really help them to achieve higher things and higher levels. So then they say, I want to do that because I want to achieve those things, and I want to do more and be recognized. And, that I think is very, very valuable to them. It does take effort though. And as somebody pointed out in the chat, it's true. Not every executive leader is good at kind of being that vulnerable to be able to share, their strengths and their weaknesses. If your staff points something out to you, I had a nurse point out to me the other day, I feel so much better now that you've told me what's happening. I really wish we had had this conversation like a month ago. And I said, you know what, that's really great feedback for me. I should have communicated better. I'm sorry for that. And I think anytime we take responsibility for those, little ways that, not necessarily seeing it as a failing, but as an oversight, right? We have a lot on our plates. But the more we take responsibility for those things, the more our folks feel heard, they feel valued, and they feel like, wow, that didn't hurt so much for them. Like maybe when I get feedback, it won't hurt so much for me either, because this is a culture of support, and maybe a little safer than your average culture.
I have to add one thing. One of the generative aspects of coaching culture has been this term thought partner. So a lot of CEOs have thought partners as opposed to coaches, but it's the same thing. It's, who can I run ideas across, get some feedback that I'm not coming up with myself. And I think one of the most powerful things that we as leaders and actually as individuals can do is tell on ourselves. The best stories are the ones where we have fallen on our own face, where we have messed up, where we have dropped the ball, where somebody who's gracious enough to pull us off our own sword and tell the story. There is life after these failures. This is what I've done with them. This is why I'm better for it. And so I think when you get so far removed from that we do a disservice and we don't build the culture. So I call it telling on myself culture. So that's part of giving room that, hey, gee, we're all human here. We're all still learning.
Wow, we really benefited from your rich answers. And let's take this a step further as we try to understand how to adopt a coaching culture. Coaching culture takes dedication and commitment from the organization. And we know time is very limited and something that health centers really have a hard time with these days. What advice would you have for health center leaders hoping to adopt a coaching culture and engage coaching and building strong leaders across their organization?
I think the best advice that I have is, I think as much as you can, build it into your regular workday. First, if you build the verbal culture in everything that you do, you will foster a coaching culture just by the way that you speak, the way that you take responsibility, the way that you share about your own opportunities for growth. and also in the policies, procedures, trainings, other things. We implemented a new ladder program for our medical assistants. Anytime you create opportunities for people to advance and to grow, it engages them in the conversation and engages them in this thought of, I should be thinking about what the next steps are. I think the other thing that we did too, which I thought was really unique, is we did some cross-department coaching. So we actually had all of the leaders were assigned up to 5 individuals who wanted to have just a 20, I think it was a 15 or 20-minute conversation. So we had 5 of these booked in our day, and they were people who weren't from our own department. So maybe I met with somebody from IT, or somebody from HR, or maybe somebody from our Weitzman Institute, somebody who wasn't a medical assistant or a nurse. And we had an opportunity to just listen to them, their hopes and dreams for the future. Maybe some of them were to build their own business outside of the organization. Maybe it was to grow within the organization, but to really think about the culture of our health center as a family, as a community that wishes good things for each other, not only within the health center, but outside of the health center, I think was really beneficial. And then we were able to share, ask for permission if there was something that we could do within the health center to help or connect that person. Sometimes we found that there were sort of unofficial mentoring that could happen. Like, I actually met some people who worked in our call center, who worked at the front desk, who wanted to be medical assistants, and they were connected with me, and I got to talk with them about, what would it take and how could they do it? What are the health center benefits that could help them to get there, and things like that. So there really are a lot of those opportunities, and even just a 10 to 15-minute touch point can really make all the difference. If you have a meeting that ends early and you get 15 minutes back, maybe spend 5 minutes of that reaching out to a staff member you haven't spoken to a while and just say, how are you doing? Anything I can do for you? Or, like, how are things? Sometimes can be really meaningful.
I would add to that, and I love everything that Mary said. So you got to have a very strong human resources or talent management, or somebody who's going to be driving this, so that your leaders have it as part of their performance evaluation. What is the retention? What kind of equity studies have you done? Does your staff look like the people who you're caring for? Where are the measurements in this? This is what gives us the power with the punch of doing this kind of cultivation of individuals. Unless we're tracking it, unless somebody is reporting on it, then it really is kind of left up to the goodwill of those who are thinking that way, as opposed to goodwill and it's my job. This is my job. And this is really directly related to the quality of care that we are able to provide for the communities that we serve. How are we serving our highest value entity, and that is our employees? What kind of consistent training? We have to get our medical training and keep up our certification, but what about checking in with, are they being challenged? Are they pleased with where they are? they getting the support that they need? Are they on the right seat on the bus? All of those kinds of things we've been trained in talent management and human resources to ask and to do. And that's how we support our leadership. And we're training our leadership so that you all are thinking, and then at times appropriately challenge human resources. But all of this has to be, I'm a numbers person from day one. If it ain't measured, it's not important. It's not going to be discussed. I want the metrics. What does it look like? What's happening? Our employee satisfaction surveys, our customer service satisfaction surveys, all of these surveys give us this kind of intel where we have opportunity and where we might be hitting it out the park, and we get to celebrate. Transparency, very, very important.
So important. Our workforce serves as the heartbeat of our health centers and everything that we do, and caring through coaching and developing a coaching culture goes a long way. I'd like to open the floor at this point for questions for our panelists.
I did see in the chat, somebody had mentioned, that they don't do performance evaluations at their health center. And I would really, really encourage you to consider the possibility of implementing one. I know that it can be a bit of a lift, and remember, you don't have to, reach nirvana in 1 year. But I do think, particularly when you look at the HRSA compliance manual, in looking at how you track even credentialing and privileging of staff, particularly your clinical staff and things like that, you really have to be able to prove competency. And so unless you're actually evaluating the competency, I mean, yes, you do wave testing competencies typically if you're AAA-HC or Joint Commission, recognized or accredited. But I do think that, you're sort of maybe skirting the edge of the compliance manual if you don't have some kind of an evaluation process. And that could look very simply at first. It could just be maybe you as an organization define a few specific values that you want every member of your organization to be benchmarked against. Maybe it isn't, maybe it is a little squishy at first and not something that is sort of hard and fast and measurable. But then as you move and refine your performance appraisal, you can add clinical data metrics or other types of performance metrics that really do kind of meet the definition of a SMART goal, where it's measurable. It is something that we can really affect change on, and can actually even encourage your staff to do that sort of rapid cycle performance improvement as you go. So I know for us, for example, 60% of our performance appraisal is all based on goals, and the majority of the goals are for our clinical team members are clinical measures. So for example, the depression screening measure, providers don't get measured on that. Medical assistants do, because they're the ones who are collecting the data. They're the ones that are triggered to know this patient is due for their depression screening. So the PHQ-2 to PHQ-9 has to be completed. Depending upon the scores, might need the PHQ-9 as well. And, over a 6-month period, if you had 300 opportunities, what percentage of those did you successfully complete the PHQ-9? The beauty of this is that in an organization, you would create what we call a measurement culture, where measuring isn't scary, right? It isn't about making you look bad. It isn't about, making you feel bad. It's to say, what are our best opportunities to look for improvement? And as we look across our organization, for us, we're a multi-site organization. So if I were a medical assistant, I would be able to see, this is how I scored in depression screening, and this is how I score in comparison to all of the other MAs at my site, because I'll have a site average. And then this is how I score in comparison to the agency average, because maybe my whole site is struggling with this, or maybe it really is just me, or maybe I have a best practice and I'm someone who should be highlighted as a leader and should do some booster training for people who are struggling. So there's a lot of things that data can do for you. And again, if the narrative and the leadership support that goes along with the data is really about reward and value and quality improvement, it doesn't feel, punitive and, nitpicky, but it really feels like we are together on the same team, really trying to all row in the same direction, which is the direction of high quality care.
Yeah, I agree, Mary. I think one of the greatest barriers to being an excellent organization is a lack of metrics. Not to have a performance evaluation, I think, is a disservice, not just to the individual who's being evaluated, but to the customers that you're serving, the patients that you're serving. Unless we have very clear job descriptions, what we're doing, what our responsibility is, and most things can be measured, but we also have looking at customer satisfaction. But unless we know what our job is, what my responsibility is, and at what level I can do that job, and different people can do it at different levels, that gives, by comparison, perhaps me an opportunity to do another job that I'm better suited for. But you have data. You also, this has been a struggle, and I expect to get a lot of responses from this, but when I got into the medical field from education, it fell very hard on my ears when fellow employees would talk about one another as we're family. We're family. I was brought in as the Chief Human Resources Officer, and I was counseling people who were having difficulty and issues, and I thought to myself, family is hurting us, because we can have warm, good feelings about people we've been in community with, our kids are in school together. But unless I see you as a team member, I'm not able to then say, gee, my family member over here, Uncle Steve, is really doing a terrible job, but he's Uncle Steve. We're going to find a place for him in this organization. If Uncle Steve has been given a performance evaluation and I've done everything I can to help Uncle Steve succeed, when Uncle Steve comes to my office, he already knows it ain't working, Jan. I know we've tried to do everything we can. Uncle Steve is not, if he doesn't take himself out, he's going to thank me for putting him out of his misery. So the language is part of the culture we're creating. So it's the opportunity as we're looking at this word coaching culture and what is the culture of our respective hospital or our FQHC or our community health center. Think about the power of that word family. I feel great affection for you. I might even like you more than I like some of my cousins and my aunts and uncles. But first, we're a team, and this is the job. The job is to do our very best for these folks who are coming here depending upon our care. So that's a little controversial, but I thought I'd just add that out there. We got to look at our language.
Hey, I think you have some truth serum there. It's very hard, to separate team from family. And then those emotions get attached in that process as well. I'd like to look at coaching from a group standpoint. How have you used group coaching, and do you think it works for those who may see individual coaching as something that they can't do? Have been able to benefit and have individuals benefited from group coaching?
I developed a program for a health system, which was a high potential leadership program. So these were individuals who were selected by some of their leaders as being folks that they could see maybe even succeeding them someday, being the leaders of the healthcare organization. And so it was a system. So there's several hospitals within the system. And so those individuals were identified. They went through a very rigorous assessment process where they were assessing one another. They were being assessed. And then the leadership decided upon who should be this formative group. And so those folks came together, and we had a list of items that we thought might be of interest to them, but we also wanted to know what was it they were interested in learning and what things worked in terms of being a group learning experience. And by having them come together, first, they've been recognized as high potential. So there's a gift in that. Then they have an opportunity wherever they're going to be working within the system to know that they're going through a process. It's a year-long process. But when they leave it, they have made these relationships. They're going to be able to call upon one another. And so the coaching became not only the experts who came in to talk on different topics, but to hear what the different perspectives among their colleagues, their equals, the people who are at the same level. And those were, for me, the beginnings of what they were experiencing as thought partners. Thought partner does not have to be somebody who's had 40 years of experience and been president of, 3 different or FQHCs. They can be the person who's sitting next to you who thinks differently and can give you an opportunity to say, wow, I might approach it this way. And it just gives you that benefit. So I think having groups is very helpful because you're forging relationships among those people that you hope will also continue to excel. Mary, what you got?
I was just responding to something in the chat too, just talking about sort of the performance appraisal and the subjective versus objective, and wanting to put some feedback in there that I know that, of course, everybody will cringe, at subjective feedback, but again, sometimes you have to start somewhere. And subjective is something that is really simple to implement. So particularly if you are starting somewhere, you're halfway through the season, you could actually roll out a new performance appraisal with 3 or 4 subjective evaluation pieces. And again, if you're not ready from a budgetary standpoint to tie it to anything merit, again, just even getting some amount of feedback and beginning that sort of communication feedback loop, having a place to start is important. And then you can always build on additional clinical metrics from there. Typically what my cycle looks like is around this time of year, so May, so like April, May, June, we develop our metrics for the year. And then I train them in June. So my team knows I'm going to measure their performance from July 1 to the end of the year. Our performance appraisal cycle ends December 31st. We begin to create our performance appraisals in January. So like by the end of February, all of our appraisals are entered and our merit process is completed in May, with our merit increases being retroactive to January 1 is typically how we work. And then the cycle starts all over. It's April. I look at, what were last year's measures. Are there any new measures that we care about? Anything new that, maybe we couldn't get data on last year that we thought we could get data on? So we might adjust a few measures. Like this year, for example, we've seen a huge reduction in our lead screening rate. So I added lead screening to our medical assistant scorecard, for example. Nursing scorecards can be a little bit challenging. We have measures around self-management, goal setting, and hypertension control and diabetes control, which of course, some of those measures are on the provider clinical scorecard as well. But we want to give sort of that encouragement to our nurses that they can be proactive and identify nursing work that needs to be done with our patients and just go ahead and do it from a population-based standpoint. So I think for us, that's sort of how our cycle is built. So if you're looking for a way to think about implementing your performance appraisal process or trying to find a way to make it a little bit more manageable, I think having a cycle and having, where everybody knows what's expected and when will really help you as a leader and will help your staff to know what to expect as well. Sounds like one of the participants may want to make a comment about appraisals as well.
Please
Hi,
go
Liz.
ahead, Ms. McLean.
Yes, hi. I just, I'm a consultant, and one of the things that I do is match the job description to the evaluation. The job description becomes the evaluation. And you may have heard of competency-based job descriptions. That's what we're using. And that takes a lot of the surprise out of things. They have a copy of their job description. They know they're going to be evaluated on exactly every single item that's on there. Now they are long. I will say that they have about 70 on an average items that they're responsible for. But I find that and I couldn't agree with you more, Mary, that meeting with the employee in between the actual annual evaluation is key to making sure, but that things are going right and there are no surprises. But I highly recommend the use of competency. Employees find it very simple to use, and I've known employees who look at it monthly and come up and say, how am I doing over here? You said I wasn't so, quite meeting that last year. So that's something to consider.
That's a great comment. I would recommend at least quarterly, and that is why there are no surprises, because one of the things that an employee, and this is a coaching tip, needs to feel is that their success is your success. You're doing everything you can to make sure that they succeed, so that after meeting 4 times over the course of the year, if you have together worked on what can we do to make sure that you can be successful in this job, what other skills do you need, what do we need to do, are you in the right bus, in the right seat on the bus, it may not take the whole year. It may not take 4 evaluations for the person to say this is not working. It doesn't have to take that long with that kind of clarity. So I do think that meeting with people regularly, and I know that my managers used to meet with their folks on a monthly basis, because that's how they would drive that ship. And so there are no surprises, because things happen where employees, something happens either personally or something happens within the organization where they need some support, time off, or some different folks to come in, different resources, compensation, money, whatever. And there's got to be that openness to, even if this isn't time for your evaluation, if you need something to be successful, you've got a beeline, straight line to me as manager.
Yeah, I think just to give you guys an example, I know I saw in the chat, I did do a poster for NAC on our medical assistant scorecards, and I can share kind of examples from last year's appraisals, both for our nurses and for our medical assistants. I'll make sure I get them to Megan after this, and she can send them out to everyone. But I think, it really took a lot of thought for us. So just as Jen was saying, our medical assistants, everything in our electronic health record is really tied to the PCP on record, which isn't going to work, particularly if, unless that medical assistant is really, really supporting that provider 100% of the time, which I think we all know that happens on a pretty, we try as much as we can. But, so what we did is we actually changed how we document in our electronic health record. So in the field of the person who takes the vital signs for that record, they actually enter their employee ID. So it is a discrete number. So I can actually identify any chart that a medical assistant roomed based on their employee ID number being in the record. So we actually run all of our data by that. So even if you worked half of the year with one provider and the other half of the year with another provider, we can really isolate your data. And I think in the FQHC world, I definitely think, of course, that, I'm definitely, I'm not in any way against competency-based learning and appraisals. Like, we do a lot of competency-based stuff. But I also think from clinical data metrics, we base a lot of our stuff on the uniform data system and a few of our other value-based contracts that are very, very important to us. And, these are highly benchmarked, clinical metrics that clearly matter to the federal government and matter to other, grantors in our state and things like that. So if there are portions of that workflow that you can tie to your medical assistants or tie to your nurses or tie to other staff members, you should be able to measure those things along the way. And as Jan had pointed out, kind of meeting with people is important, but I think even more important is getting the data into their hands. So we are in the process of refining for this year, based on a few of our new added metrics, a dashboard where our medical assistants and staff can go to anytime and they can run, like, how am I doing on depression screening? How am I doing on this? They can look at the last week, they can look at the last month, they can look at the last 2 months, because what that does is it motivates them to be able to say, you know what, I can do some self rapid cycle performance improvement here to figure out, like, why is my data not counting? Like, what is happening? Like, am I not clicking the right box? Am I just forgetting to ask these questions? Like, what's the problem? And it really encourages them. Like, we create also a communication plan where they can reach out to me, they can reach out to our data teams to say, listen, I did this work, it's not showing up on the dashboard. Like, can you help me? And we will look into it and we'll figure out exactly, why didn't it show up in the data? Is it because maybe the note wasn't locked in time by the provider, or maybe the medical assistant does need some additional training on where to click? And I think the beautiful part of it is that at the end of the day, we have proven that we all want the same thing. We all want the highest quality care, but sometimes with all the different clicks that we do in a day and the 47 measures that we're looking at, it can get very confusing and it's easy to make a mistake, right? So this helps us to identify those mistakes, identify those training needs, so that we can best be the leaders that we need to be for the staff that we're leading.
Thank you so much for that and this rich conversation. We appreciate you taking the time today to participate on our panel. And we know that it's because of you, we have all gained more information around the value of creating a coaching culture. As we end, can you give us just one more seed of advice that can help us understand what we can do to adopt a coaching culture?
For me, my experience has been that any kind of culture development or cultural change must start with the executive team, and actually beyond. The board needs to be involved and they need to be trained, because those are the folks who are going to be holding everybody else accountable. So if you want any kind of culture that you want to bring, whether it's a wellness culture, a high performance culture, or a coaching culture, which is all part of a high performing entity, you've got to have leadership from the top who's tracking it, who is passionate about it, who has the staff who are also excited about it at every level, so that it doesn't matter the level that comes to the executive to say, hey, we had an opportunity where I think we dropped the ball here on being able to explain what went wrong. The level should not matter if it's the culture. And something that's very important, and I think it's hard, it's the truth, but it's real, it's substantiated by data. It takes 3 to 5 years to see any kind of real cultural change in an organization. So that means there's got to be a commitment, and it's got to be constant conversation. Every single management meeting, every single staff meeting, these are the values, this is how we're changing. Here's examples. Look at when Mary did XYZ. whoa, go Mary, that's really representing this cultural value. So it has to become an integral part where everybody understands it in plain English.
Thank
So the
you.
pictures on the wall, the activities that we do, the celebration of the metrics, all of that.
Thank you so much for that. And we are over time, and I want to
Sorry.
be, no, it's okay. I want to be conscious of our time. Mary, if you have one word for us.
One quick thing is I just think always believe the best about your team, even if you have to bless them to do their best work somewhere else, like it is what it is. But whenever you're giving them coaching feedback, always believe that they can do it. And always speak to them as if you think they can do it, because that is going to be what's going to ultimately motivate them and show you whether or not they truly can. And sometimes people that you didn't think could do it really rise to the occasion, and it's worth it in the end.
Thank you so much for this panel today, and I'll send it right back to you, Jared.
Thank you so much, Stephanie, Mary, Jan. We really enjoyed that discussion. Greatly appreciated. And I'm going to turn it over to my colleague, Helen Vernier with ACU, and she'll lead us into a large group discussion. Helen?